Miss A, a 10-year-old student with a history of Asperger's, is brought to the school nurse's office by a paraprofessional because she was not acting right. Her speech was slurred and her skin was pale that is cool to the touch. She is newly diagnosed with type 1 diabetes and is not yet able to identify her symptoms to know to go to the nurse's office. Due to the child's functional disability, she is unable to identify change that would accompany her newly diagnosed type 1 diabetes, as her body's tolerance and receptors of chemical change within the body are not inherently acknowledged, but instead need to be taught/learned. The school nurse has the student nurse take the child's glucose with the blood glucose monitor. Miss A posed some difficulty in checking her blood glucose because she does not like to be touched. Miss A also has hypersensitivity to touch and pain, therefore the feeling of the alcohol pad and needle are not welcomed. After some encouragement and distraction, the school nurse was able to obtain the child's blood glucose. The result was 54, indicating hypoglycemia. The nurse attempts to find a snack the child likes that is high in carbohydrates to bring up the child's blood sugar. This caused some issues for Miss A. Children on the autism spectrum tend to be on a strict schedule that they follow day to day. Offering a food or snack at a time other than a set mealtime will cause the child to reject the offer. Since Miss A is newly prescribed insulin, Miss A's mother came to school to drop off the insulin pen to the nurse's office. When arriving in the nurse's office, she sees her daughter there and is immediately concerned. The school nurse decides to use this opportunity while waiting to recheck the child's blood sugar to educate the mother and student on diabetes and proper techniques of checking blood glucose and administration of insulin. The school nurse also used this opportunity to educate the child's mother about the child's IEP. The IEP was established when the child was diagnosed with Asperger's and should now include a plan of care of diabetes while the child is in school. Once the mother's understanding is established, the school nurse goes on to educate the mother on immunization schedule and autism. When the blood sugar was rechecked, it was 95 and the child was able to go back to class. Good morning, Miss A. What brings you to the nurse's office?
Miss A was not acting right while in class as she normally does. Her skin looks pale and she is cold to the touch.
Miss A was just recently diagnosed with type 1 diabetes. She is not yet aware of the symptoms of hyperglycemia and hypoglycemia to know to manage it. Keep in mind the student is also on the autism spectrum. Due to the child's functional disability, she is unable to identify change that would accompany her newly diagnosed type 1 diabetes. Her body's tolerance and receptors of chemical change within the body are not inherently acknowledged, but instead need to be taught or learned. With that being said, what would be the first thing we should do for the student?
So depending on her glucose level, we can either give her a snack high in carbohydrates or administer insulin. But before we do that, we should check her glucose level.
Good. Make sure to wash your hands first.
Okay, Miss A, I'm going to check your blood glucose now.
No!
It will be quick and over before you know it.
No! Miss A, what is one of your favorite videos to watch?
Baby Shark.
Okay. Go ahead and try the blood glucose now. Using a distraction is a helpful way when trying to test a child's blood glucose. It could be something as simple as a video or even listening to music.
Hi, I'm here to drop off insulin for my daughter. Is
Hi.
everything okay? Why is my daughter here?
Your daughter's power brought her here because she was not acting right in class and looks pale.
We are currently checking her blood glucose. Her blood glucose is 58.
Miss A experiencing a hypoglycemic episode. If blood glucose falls below 60, oral glucose tablets or a snack high in carbohydrates will need to be administered. The history of type 1 diabetes is as follows. Type 1 diabetes affects approximately 5 to 10% of people with diabetes. It is characterized by destruction of the pancreatic beta cells. Combined genetic, immunological, and possibly environmental factors are thought to contribute to beta cell destruction. Though the events that lead to beta cell destruction are not fully understood, it is generally accepted that a genetic susceptibility is a common underlying factor in the development of type 1 diabetes. This genetic tendency has been found in people with certain human leukocyte antigen types. This is also evidence of autoimmune response in type 1 diabetes. This is an abnormal response in which antibodies are directed against normal tissues of the body, responding to these tissues as if they were foreign. Autoantibodies against islet cells against and against endogenous insulin have been detected in people at the time of diagnosis and even several years before the development of clinical signs of type 1 diabetes. In addition to genetic and immunological components, environmental factors such as viruses or toxins that may initiate destruction of the beta cells are being investigated.
So, regardless of the specific cause, the destruction of the beta cells result in decreased insulin production, unchecked glucose production by the liver, and fasting hyperglycemia. In addition, glucose derived from food cannot be stored in the liver, but instead remains in the bloodstream and contributes to postprandial hyperglycemia.
So what should Miss A's glucose level be at?
So, if the concentration of glucose in the blood exceeds the renal threshold for glucose, usually 180 to 200, the kidneys may not reabsorb all of the filtered glucose. The glucose then appears in the urine. When glucose is excreted in the urine, it is accompanied by excess loss of fluids and electrolytes. This is why it's important for the student to regularly come to the nurse's office to check her blood glucose levels. Indications of hypoglycemia is a blood glucose under 60.
Are there any signs I should look out for if my daughter is experiencing hypoglycemia?
Well, when blood sugar drops, you may notice the child feeling tired, fatigue. The skin might look pale, the child may start sweating, say they're hungry, and become irritable. At this point, it would be a good idea to test the child's blood sugar to get an accurate reading of where she stands. Most of the time, hypoglycemia occurs when the child has not eaten, so a fasting state, or after taking part in gym activities. Hypoglycemia affects everyone differently. However, those were just some common symptoms.
Okay, so what should I do when my daughter's blood sugar level drops this low?
You can offer your child a snack or a drink that is high in carbohydrates.
She's absolutely right. You can offer your daughter foods and drinks such as orange juice, milk, honey, raisins, hard candy, followed by eating food with complex carbohydrates, fat, and proteins such as a peanut butter sandwich on whole grain bread.
Miss A is very picky when it comes to snacks and drinks, so that may be a little difficult. She only eats a small variety of foods.
Did she eat any of the things I listed?
She does like raisins.
Then let's try that. Here, Miss A, let's try eating some raisins to bring up your blood sugar.
No, it's not lunchtime. I have to go back to class. It's not lunchtime.
It's okay, Miss A, you can have them. I'm eating them too.
Okay.
Now that she's eating a snack that will bring up her blood sugar, how often do we recheck the sugar?
Every 15 to 20 minutes until the blood sugar is within normal limits.
Yes, that's right.
So now that I understand what snacks to administer in case of a hypoglycemic event, would you be able to explain how the different types of insulins work and how I'd be able to detect the signs and symptoms of hyperglycemia?
Of course. In the event that your child's blood sugar are severely elevated, there are some symptoms you would want to look out for. Extreme weakness or tiredness, excessive thirst, increased urination, abdominal pain, nausea and vomiting, blurry vision, irritability, or quick mood changes and changes or loss of menstruation. To treat a hyperglycemic crisis, you want to administer insulin. So there are 5 types of insulin: rapid acting, regular or short acting, intermediate acting, long acting, and premixed. The rapid acting insulin takes effect within 15 minutes and you should take it right before a meal. Someone who doesn't have type 1 diabetes, their body releases insulin when they eat, so which helps them process and use carbohydrates in the food. The release of insulin at mealtime is called the bolus secretion, and the rapid-acting insulin imitates the actions of the bolus secretion for the type 1 diabetic client. Next is the regular or short-acting insulin, which takes effect within 30 minutes to an hour. This is also taken before a meal, but its effects last longer than rapid-acting insulin. It is injected 30 minutes before a meal and also imitates the bolus secretion. Would you like to explain the intermediate-acting, long-acting, and premixed insulin?
Sure. So the intermediate acting insulin lasts for about 10 to 16 hours and is generally taken twice a day to imitate basal secretion. Basal secretion is the small amount of insulin that's always in your blood if you don't have diabetes. In order for your body to function efficiently, it needs this basal secretion. Therefore, people with type 1 diabetes must take this insulin. Long-acting insulin is similar to intermediate, as it also replaces the basal secretion. It lasts for about 20 to 24 hours, so you usually take it only once a day. However, some people may need to take it twice a day for better control of their blood sugar. Lastly, there is the premixed insulin, which combines 2 other types of insulin. For example, It can be a combination of rapid acting and intermediate acting so that you have the right amount of insulin to cover both the bolus and the basal secretions.
And how will I know how much insulin to give to my child? Will someone provide me with the right dosage?
So your doctor will calculate the dosage for your child the first time you go there. He will take into consideration Ms. A's weight, age, diet, overall health, and treatment goals to come up with the best insulin plan. You may need to adjust insulin doses based on how your child's glucose level responds. For example, if your child's glucose is too high in the morning, you may need to give more insulin. Working closely with your doctor to monitor your child's blood sugar and adjust insulin doses will help you achieve the best blood glucose goals.
Where do I give my child insulin if her sugar is too high?
So there are 4 main areas to inject insulin: the abdomen, the back of the arms, the thighs, the hips, or the butt. When injecting insulin into the abdomen, it is absorbed the fastest. It is important to change injection sites because it can cause the site to absorb slower if overused. Just like the finger stick, try to use a distraction if insulin is needed.
So if your child becomes ill with something like the cold or flu, this may cause the blood glucose levels to rise, especially if you are giving over-the-counter medications. If your child is vomiting or is unable to eat, this may cause her blood sugar to decrease. It is unpredictable how a sickness will affect your child's blood glucose.
It is important to check her levels more often than normal. A guideline you could use is to check every 2 to 3 hours. Your child may require more checks depending on what your provider suggests. Make sure she is drinking plenty of fluids to prevent dehydration, and ketoacidosis. If your child is unable to eat normal, make sure she is taking in a certain amount of liquid or solid carbohydrates to prevent a drop in blood glucose.
Since my daughter is newly diagnosed with diabetes, would her diagnosis need to be added to her IEP?
Yes, it would need to be added to our IEP. Would you like to explain what an IEP is?
Sure. An IEP, Individualized Education Program, is the process put in place under the Individuals with Disabilities Education Act to determine the programs and services that should be provided to meet the education needs of a child with disabilities. An IEP must be developed to address a child's specific and unique needs and is not a one-size-fits-all program.
Can you refresh me on the contents of an IEP?
Of course. The IEP states the child's present level of education performance. This should include both academic and non-academic aspects of his or her performance. A statement of goals that the student may reasonably accomplish in the next 12 months. The statement should also include a series of measurable intermediate objectives for each goal. This will help both the parents and educators to know whether the child is progressing and benefiting for his or her education. Development of well-defined goals and objectives is crucial for your child receiving an appropriate education.
So due to her recent diagnosis of diabetes, school staff will be informed of her condition, educated about signs and symptoms of hyper and hypoglycemia, and granted permission to go to the nurse's office to receive frequent blood glucose readings and snacks when sugar is low.
Okay, great. I was worried about that. Will the diabetes affect my child's autism?
No, diabetes will not affect your child's autism. The only thing that it may do is disrupt your child's already established routine by adding frequent blood checks and having snacks outside of normal meal times when blood sugar is low. What do you know about the autism spectrum?
Autism spectrum disorder is a complex neurodevelopmental disorder believed to be of genetic origin with a wide spectrum of behaviors affecting an individual's ability to communicate and interact with others. Cognitive and language development are typically delayed. Characteristic behaviors include inability to maintain eye contact, repetitive actions, and strict observance of routines. Onset is usually infancy to early childhood, usually before 3 years, and the spectrum ranges from mild to severe. You need to screen all infants and toddlers for warning signs, including not babbling by 12 months, not pointing or using gestures by 12 months, no single words by 16 months, no two-word statements by 24 months, losing language or social skills at any age, distress when routines are changed, withdrawn, spends time alone, avoids eye contact. Do you have any other questions or concerns?
I was also wondering when my child's next immunizations are due. She's actually supposed to go to the doctor next week.
Oh, okay, so once she turns 11, she would receive Tdap, HPV, and a meningococcal vaccine.
Okay, thanks.
So it has been about 20 minutes since she had her snack. Let's recheck her blood sugar.
Okay.
The video.
Yeah, try playing the video again.
Can I see your hand?
Ow.
Good. Her blood sugar is 95.
Perfect. She can go back to class now.
So to break down what we did as a school nurse,
As a school nurse, I was educating the mother and having the school nurse also provide information that she knew off the top of her head about diabetes, autism, and IEP, the different symptoms of hyper and hypoglycemia, and
yes, and so then I was able to check the student's blood glucose, and we waited 20 minutes in between giving her a snack to recheck it again before we could send her back to class. And by the end, we had a good blood glucose reading of 95, and we were also able to educate the mother with the IEP, the immunizations, and how we will be able to help her now that her daughter was also diagnosed with diabetes and is on the autism spectrum.
So, like she said, as the mother, the school nurse and the student nurse educated me about the different types of insulins, how they work, when to administer them, how to administer them with meals or without meals. She also educated me about what an IEP is and the different contents of it, as well as how that would affect, how her new diagnosis would affect the IEP that's already in place for her diagnosis of autism.
So as the child, I tried to express how an autistic child would react at that age level by like examples like getting distracted or not making eye contact, throwing gloves and things like that. And while my mother was being educated, because I wasn't able to understand.